Welcome to the advent of AI. I'm your host, Paul Drake. I am joined today by Alex Doonanco from CareCycle, and we're going to talk about something a little bit different. Typically, I'm a P&C guy, so I talk about P&C stuff because I understand P&C. But the insurance world is a big, big world, and no surprise, in other areas of the insurance world, there are significant challenges. And specifically, today we're going to talk about Medicare agencies. When Alex and I first talked, we were talking about the challenge of churn for these agencies. And so instead of talking about features and hype and throwing these kind of broad statements about how AI is going to change your life, Alex and I both share the same vision. We want to talk about the practicalities of how does this actually work? How is this actually going to improve the lives of those who are working at Medicare agencies and help them reduce churn, and get into some of the specifics of the ways in which the team at CareCycle has actually employed certain AI tools that don't replace people. They don't do all the work. They just enable the team to do better and more, and do so in a very considered and thoughtful way. I'm incredibly impressed with what the team has done. I'm going to turn it over to Alex to give a quick introduction to talk about CareCycle, and then we will jump into the subject at hand. But again, I'm really excited to kind of diverge and talk about different areas of insurance where AI is applicable. Thanks for joining, Alex.
Thanks so much for having me on, Paul. Huge fan of what you're doing, taking a more educational angle, focusing on the practicalities. I recently saw a study from Accenture around the impact on sentiment of the term AI-powered in marketing. And it's been so overdone that it actually carries kind of a negative connotation now. So there is definitely an abundance of hype, as is always the case with the new technology. There's a lot of very overarching claims about how transformative it can be. So I'd love to spend this time talking, like you said, about those specific areas where it can become useful to solve a specific pain point. I said at Medicarians last year, actually, the question should not be going out there, figuring out which AI tool to use. It should actually start with what's the problem in the business that we need to solve from first principles, and then find a solution, whether it involves AI or not. And AI is just another kind of collection of solutions that might be the solution.
I'm really glad you mentioned that, because one of the things that I'm trying to do with this podcast is I'm trying to show you, the audience, all the different ways in which AI works and all the different types of problems it can solve. So you get an idea and an intuitive understanding of the types of problems that AI can solve. But any good business owner is going to have a clear idea of what are the top problems that they need to solve. And then they're going to evaluate the available solutions. And like Alex said, AI solutions are part of that. The other thing I want to mention is that, and you and I talked about this in our initial conversation, there's just so much hype around AI, and I just would like to apologize because we're all a bunch of nerds, those of us who are using this technology, and it feels miraculous. And so my poor wife gets to hear about AI way more than any of you will ever hear about AI. But it's because it's truly transformative. But like any great tool, it really matters what problems you're solving. So let's talk about the problem today. Churn for Medicare agencies. Alex, I'm going to kick it over to you. Tell us about this. Why is this a problem? How is this working in the Medicare for Medicarians as a whole?
Yeah, so Medicare is a very, very competitive market, as is the case in P&C as well. And so what takes place is during annual enrollment period, that's Q4 each year, that's a time where all seniors are eligible to add or change their Medicare Advantage plans. And so to give you a lay of the land, there's about 60 million Americans on Medicare Parts A and B. About 50% of those and growing are on Medicare Advantage and Medicare Supplement plans. These are provided privately, and they're sold and maintained by a distributed network of agencies and field marketing organizations, FMOs. And so the bulk of the industry in recent years has taken a very telephonic approach. So there's a lot of call centers doing high volume, and they rely heavily on digital marketing, online ads to drive inbound calls to them. And so what's taking place with regards to churn is that there's evolved this very, very quick sales process in the space where, through a combination of tons of targeted advertising and outbound calls to seniors, particularly during AEP, it can be incredibly confusing to navigate. And there are several people trying to tap their lines and tell them about the latest and greatest plan so that they can actually help them switch plans. And so there's a phenomenon where some seniors have become what they call super shoppers. They might be changing their plans several times a year. Now, this is an incredible challenge for the industry and for those agencies distributing, because they actually get paid for that policy based on when it's retained for at least 90 days. So if you sell a ton of policies, but those people don't stick with you for 90 days or more, you actually don't get paid for that policy. And on the flip side, for the consumer, you take a system that's already quite confusing and you just make it exponentially more confusing when licensed advisors are targeting you to such an extent that there's a loss of trust as to whether or not those agents are in fact playing their role as your trusted advisor. And so there's kind of a tendency to keep shopping. And that's exactly what we're alleviating with CareCycle by adding more touch points and more continuity into the whole Medicare journey, as opposed to just the front end sale.
What percentage for an agency? What percentage or churn are they looking at right now? What is the baseline that they're dealing with typically?
Yeah, so I would put it this way: the boat is leaking in Medicare. So if you were to look at the average churn rate of a Medicare agency today, if you were to apply that to any other industry like software, you would say that is a dying business, but it's simply the status quo in Medicare. So this past AEP, it kind of hit its zenith. So we're seeing effectuation rates as low as 70%. We're seeing 90-day retention rates as low as 50%. Now, effectuation is basically the period of time between when a policy is sold and hits its effective date, be as short as 15 days. So within 15 days, as many as 30% of your customers are going to another agency, buying a different plan, or canceling their plan altogether. So it's a huge signal that there is a lot of confusion in the consumer space, and there needs to be more reassurance. There needs to be more education and more kind of stop shopping, providing them a space to address any questions or concerns they have about the plan before they continue to go elsewhere and, call into the next ad that they see that might look interesting.
We're going to get to AI in a second. Before AI, what are these agencies doing to try to prevent the boat from sinking, so to speak, with all of this churn? What are they doing? How do they even combat this?
Yeah, so I'm glad you asked. There is an interesting distribution that you can see in the industry on how people are tackling this. On one side of the spectrum are what I like to call kitchen table agents. They are very traditional. They meet with their customers in person, and they have a very good track record of staying with those customers for life. Because they've built such a strong, trusted relationship, they've literally met with them face to face. So their LTV is looking fantastic. On the other side of the spectrum, you have some of the more tech-enabled FMOs coming into the space that place really high emphasis on branded marketing on the front end and then really high-quality customer care on the back end. So, the top 5% of agencies in terms of retention are doing a few really obvious things. Now, obvious or simple, as we know, doesn't mean easy. So some of these things include, giving every new beneficiary you enroll a welcome call to provide them with next steps, expectations, and a space to feel heard if they have any questions or concerns about their plan. Some folks are doing that today. Now, that brings me to kind of the bulk of the industry, which is in this brutal position. Reaction to solving churn has actually been what most would do in most industries, which is let's try to outgrow the churn by selling as many policies as possible at as low a cost per acquisition as possible. And what that does is it creates this vicious cycle. So it starts with the marketing. In order to get lower cost per acquisition, you need to find new creative ways to generate inbound calls for cheaper. So the ads get more aggressive. And what that does is that causes a misalignment in the consumer intent driving that inbound call, what they're actually calling about, and what the agent is trying to sell them on the other end. So as a result, agents end up spending hours speaking with people who aren't eligible or interested in a plan, but they might be looking simply for the free cash that was advertised to them that caused them to make the inbound call. And so on the front end, agencies are dropping hundreds or thousands of calls a day, some of which are solid sales opportunities. A lot of them are not. So we're doing some pre-screening on the front end for that. And then on the back end, many of them are having challenges with how do we implement these simple things like welcome calls and always on member care, because it involves quite a challenge with staffing. They want sales agents and licensed reps to be available to close new policies as they should. Once you introduce making, for example, outbound calls or being available for inbound calls for existing customers, you need to hire this entire new team, build a tech stack around it. And so it's a huge pain point. And for most agencies in the middle, it remains kind of this distant dream, this thing that we'll do next quarter or next year. And with CareCycle, we're enabling them to essentially hire that autonomous member care team out of the box on day one and bolt onto their existing tech solutions.
This is a tremendous opportunity for AI, because whenever you can say from a value proposition, anytime that you can say, hey, that thing that is that far off dream that you have that's going to require you to hire a ton of people and train them and onboard them and get the tech stack right. And if you can get that within days or weeks of implementation of a system like what CareCycle is doing, that's tremendous. And I think that's the thing. One of the promises with AI is if AI can handle a part of your workload and right out of the box be able to handle it or be able to handle as fast as possible with a shortened implementation time. That's a tremendous win for the industry. And so I want to transition now. I want to hear not just what CareCycle does, but some of the thought process that y'all had into making sure that it's not just that AI can answer the phone or handle phone calls, but how do you do that in such a way that's effective to actually impact the metrics, impact the problems with churn, and even improve customer experience?
Yeah, great question. So it's been a long journey to get here. I've been in voice AI for approaching 3 years now, doing contact center automations in a variety of industries, financial services, home services, legal, a lot of medical, a lot of healthcare. And what I discovered along that journey is that while most are still focused on developing a great AI assistant or a great AI that can talk on the phone, we've moved beyond that to what we call AI teams, which is really critical. So if you think from a practical perspective, just thinking about customer experience and what should be from first principles. You think of things like, I want to be able to call a business that I pay a lot of money for a critical good, and I want to be greeted instantly by first name. I want to, if I miss an outbound call from that company, I want to be able to know via text message or branded caller ID that I missed a call from that company. And when I call that number back, that toll free, I don't want to just hear beeps or be left on hold. I also want to be greeted by first name. So we've done a lot of thinking about every corner case that takes place, both on pre-sales and like post-sales retention workflows when it comes to whether someone calls in and it's after hours or it's during hours. Are agents available to be warm transferred to? Human agents, that is. Are they not available? What does the appointment scheduling workflow look like for agents? Are they a call flow that's available to take inbound calls? Are they more on a scheduled basis? So we've developed solutions to handle that in this solution that we call campaign. So a campaign is not an AI assistant, but it's a cluster of up to 15 AI assistants that our customers don't need to worry about how to orchestrate. But what it creates is this experience of continuity where when a customer calls in, they're greeted by first name by an assistant who knows who they are and knows, for example, that they had a question about whether their plan covers a particular dentist in network 2 weeks ago. So creating that sense of continuity was really our starting point. And it's just kind of evolved around that. Creating a product that allows our customers to be in the driver's seat is really critical. So there are several tasks that AI can do today that are very simple. For example, providing someone's member ID number when they ask for that. We have that data on hand. That's quite easy. However, if they call in and they're asking to find a new in-network care provider for vision, there needs to be a workflow to handle that doesn't expose you to liability risk because AI said the wrong thing, and also doesn't create more work for you and your agency to address that problem. So what we've developed around that is a system we call inquiries. So what we've done is we've broken up every category of questions related to Medicare plans that customers have and the frequency at which they occur. We've then bucketed them into areas where the AI assistant can help end to end, but also areas where the AI assistant will actually serve that inquiry to our front end to be answered by a licensed agent and dispatch a separate AI assistant to provide the correct answer that was actually generated by a human, not AI. And then in more serious contexts, we schedule appointments and we warm transfer.
I really wanted to double click on this particular point. So what you're able to do, and this is what you and I talked about initially, and I thought was really exciting, is that you're able to tap in a human being to provide the kind of input a human being should provide, but they don't have to necessarily hop on the phone. They can relay that message back to the AI, which then relays it in a consistent and a comprehensive manner to the insured. So there's this triaging that happens to determine when should humans be involved, and that's been designed over iteration of what you're doing. And then when humans are involved, you're able to get them involved in the most minimal way possible so that they aren't getting constantly interrupted to have to hop on a 10-15 minute phone call. The time savings is tremendous. What are some of the other problems you see that AI is able to solve for in this industry and that you're actively solving now? And then how can folks get a hold of you?
Yeah, so the thing that we're most excited about is what we call agentic actions. So we've so far developed a system that can handle or dispatch tasks for every non-licensed agent task that takes place in the Medicare journey. What happens next is really exciting, where we incrementally automate more and more of those inquiries that come up in the Medicare journey. So today, if somebody, for example, asks to find a new in-network care provider for dental, vision, hearing, etc., there's a workflow where we still need to pass that to a human.
Yeah.
But we're currently working on systems where we can actually find that in-network care provider based on the summary of benefits and then based on validating, and even go as far as scheduling an appointment on the consumer's behalf for that and in-network care provider. And that's based on collecting data from usage and figuring out which questions come up most commonly for beneficiaries and what that workflow looks like before then automating or developing a new approach to handling it as opposed to the status quo.
That's tremendous. How can people get a hold of you? How can they learn more?
Yeah, so they can book a demo, carecycle.ai/demo. Recommend you check out the site. You can also give our AI SDR a call. She will have a lovely conversation with you, just like I would, about the things that our systems are capable of, and can also schedule an appointment with me. She'll also give you a call back at your appointment time and then warm transfer to me with the context of the dialogue that they had previously with you.
I feel like that would be a better CTA. Instead of going to the demo, give them a call. Give them a call. That's an amazing way to actually get your hands on this technology. Alex, thank you so much for coming on. Thank you for listening to Advent of AI. And we'll look forward to learning more about Alex and CareCycle. And we'll love to have you on more as we explore more of the different ways that AI is being able to impact the Medicare industry. So thank you all for listening. Have a great day.